Do you get sick when you're around things like car exhaust or certain perfumes, maybe nail polish or even hairspray? You'll want to pay attention to this next story then, especially if you're thinking about having kids.
So researchers at UT Health San Antonio are saying that parents with a high chemical intolerance are more likely to have children with autism or ADHD. They published their findings earlier this month after they surveyed more than 4,700 parents. Garrett Berger asked the study's senior author what this means for you.
In recent decades, the prevalence of people with ADHD or autism have increased. Dr. Claudia Miller and her colleagues think they may have a reason why.
And this is why we think autism has been increasing over the last several generations, especially since World War II, because our exposures to these foreign chemicals, if you will, are all mostly new since that time.
In a study published in the Journal of Xenobiotics, the researchers found a possible link between the two disorders and chemical intolerance. That's an issue, Miller says, can be caused by large or repeated exposure to toxins like pesticides, solvents, toxic mold, or smoke from chemical fires. The researchers believe that affects mast cells, which are part of the immune system. Then, when you're exposed to smaller doses of those toxins, or even certain foods or fragrances, you feel sick. And the state of your mast cells, the researchers believe, could affect your child's likelihood of developing autism or ADHD.
Even prior to conception. So if you're thinking about having a child, you don't want to have exposures like that if you can avoid it.
They found parents with the highest chemical intolerance issues were almost 6 times more likely to have a child with autism than those with the least issues, and about twice as likely to have a kid with ADHD. Because it was just an observational study, they need more research before they can confirm it's a cause.
It's enough evidence. There's enough evidence to intervene.
But intervene how? Miller says you can avoid further exposure to chemicals, or if you're already intolerant, to your triggers. So using things like non-toxic cleaners and avoiding items like fragrances, pesticides, toxic mold, or even nail polish could help you from increasing your risk. But she can't say if anything will lower it.
The most important thing probably is how we regulate products in this country and what gets onto the market and the things people then use in their homes.
Garrett Berger, KSAT 12 News.
So that begs the question, how do you know if you're chemically intolerant, right? There is a quiz that's out there that can get you started on finding that answer. It's pretty simple. As you start out here, it's just 3 questions, all yes or no answers.
So this is called the Brief Environmental Exposure and Sensitivity Inventory, or BREESE. The first question is here. It's, do you feel sick when you're exposed to tobacco smoke, certain fragrances, nail polish remover, paint thinner, fresh tar or asphalt, cleaning supplies, new carpet or furnishings? Yes, it's a long list.
Second question, are you unable to tolerate or do you have adverse or allergic reactions to any drugs or medications or to an implant, prosthesis, contraceptive chemical or device, or other medical, surgical, dental material or procedures?
And here's the third question. Are you unable to tolerate or do you have adverse reactions to any foods like dairy products, wheat, corn, eggs, caffeine, alcoholic beverages, or food additives? Now, if you answer yes to any of these questions, UT Health then recommends that you take a much more detailed quiz, and that's called the KESE.
Yeah, that's a lot longer than this one. Yeah. It asks you how you rank how you're impacted by exposure to certain chemicals or foods, how bad some of these things make you feel. Now, we have both of these questionnaires posted on our website right now. You can take them for yourself. You can find those at ksat.com.